Doctor, you mentioned on direct examination that the patient had carcinoma of the ear. That is correct. Is there some correction to that? Well, you have to amputate the ear or conduct an otoplasty, which is the plastic repair of the ear. Doctor, what about the external auditory meatus? Well, that is a passageway. And does the foreign body in the external auditory meatus affect adversely the patient? Yes, it does. It results in a papilloma. And otoscopy is what? Otoscopy is the removal of the foreign body. You mean, doctor, the excision of the papilloma? That is correct. It is an endoscopic examination of the external auditory meatus for removal of the foreign body or lesion. Doctor, what about the middle ear? The middle ear, or otitis media, may be acute or serous. Doctor, you say serous, not serious. I said serous. The paracentesis of the tympani, which is the puncture of the eardrum and evacuation of fluid from the middle ear. Doctor, the myringotomy mentioned in your medical report is what? A myringotomy is an incision of the eardrum and a drainage of the middle ear. Doctor, what about the perforation of the eardrum? Well, that was chronic, as a matter of fact. This patient had, as I said, a myringoplasty. And a myringoplasty is what, doctor? It is the reconstruction of the eardrum. Doctor, this is all respecting the middle ear? Yes, it is. And also, it affects the mastoid. Doctor, otitis media is acute in this case? Yes, it is acute, as well as mastoiditis acute. Doctor, what is a complete mastoidectomy? A complete mastoidectomy is the scooping out and obliterating of the infected air cells. It is a removal of the diseased mastoid process. Doctor, this is also with the middle ear? Yes, the middle ear. The otitis media, chronic rather than acute. And it is also suppurative. Doctor, a radical mastoidectomy or modified radical mastoidectomy is what? That is the end-oral approach to temporary bone and thorough removal of diseased tissues. Doctor, in other words, a repair of the middle ear? Yes, a surgical creation of a new cavity composed of healthy mastoid tissue, the tympanum, and external auditory canal. Doctor, with respect to the mastoid, you mentioned that before, and I said mastoiditis chronic, which is a perforation of the paratensor. Doctor, the tympanoplasty with or without mastoidectomy, is that what you were referring to? I am referring to the closure of the perforation by skin graft or vein or fascia or perichondrium. Doctor, the middle ear, again, is the otosclerosis in this case? Well, there is a stapes mobilization, which is a surgical opening and loosening of the stapedial foot plate. Doctor, the otosclerosis is conductive deafness with fixation of the stapes? That is correct. In other words, a stapes mobilization. And is there a vein plug stapedioplasty? Yes. Or the removal of the entire stapes, insertion of the vein plug, causation of an arthroplasty for intact sound conduction. Doctor, fenestration operation is of the oval window? Well, it is the removal of the stapes and foot plate, creation of a new oval window, and replacement of the stapes. Doctor, that is fenestration? That is fenestration. Now, with respect to the internal ear, well, the internal ear takes into account the Meniere's disease. that this patient had. Is that labyrinthectomy? Well, it is unilateral if it is end-oral or post-oral in its approach to the inner ear. Doctor, what is exenteration? Exenteration of the ear cells is removal of the ear cells. And is it avulsion of endolymphatic labyrinth? Well, it is the destruction of the membranous labyrinth. Is that unilateral or bilateral, doctor? It is ultrasonic surgery, actually. Selective destruction of osseous vestibular labyrinth by ultrasonic waves, avoiding bombardment of the cochlea. Doctor, finally, the vestibulocochlear nerve is what? Well, that involves the acoustic neurons. There is an excision of the neoplasm, which is the removal of the neoplasm, which involves many areas of the neural passageway of the hearing. How's that? Was that technical enough?